Tonight, a newly proposed ballot initiative here in California is gaining attention and getting criticism for being named after alleged murderer Luigi Mangione. Good evening and thanks for joining us. I'm Marcella Lee.
I'm Carlo Cicchetto. The Luigi Mangione Access to Healthcare Act is named for the 26-year-old who allegedly killed the CEO of United Healthcare back in December. Tonight, CBS 8's Richard Allen talked with the attorney behind that measure.
Richard joins us now with more on why the attorney opted for this controversial title. Richard?
Well, that's right. And the title itself is causing a lot of people to do a double take. Now, the Luigi Mangione Act would make it harder for health insurance companies to deny medical care, essentially making it illegal in California for anyone other than a doctor to deny medication or medical procedures to a patient. And while its controversial name is generating attention, this proposed measure has a long way to go before it could become state law.
We're tired of insurance companies denying them health care.
Retired litigator Paul Eisner, who still holds an active license to practice law, says his brush with cancer more than 15 years ago turned into a battle with his insurance company, which denied medical care he says he needed.
It was a question of, were they going to pay for it or was I going to pay for it and litigate it?
Eisner says this personal experience motivated him to draft this new proposed statewide ballot measure, which would make it illegal to, quote, delay, deny, or modify any medical procedure or medication, leaving that right only to a licensed physician.
It at least means they're going to have a medical opinion, not an adjuster saying, we want to save money, therefore we're not doing it. And provides a cause of action to keep carriers to do the right thing.
The initiative would let patients sue insurers and potentially receive both attorney fees as well as 3 times the amount of actual damages decided by a jury.
Which means the carriers may find it cheaper to do the right thing, and that's the idea.
But what's the idea behind naming this measure for Luigi Mangione, the man accused of murdering 50-year-old Brian Thompson, CEO of United Healthcare?
For a very simple reason, it's getting the attention it needs. Because sometimes things require publicity.
Eisner is already coming under fire. The California Association of Health Plans, a statewide trade group representing both public and private healthcare plans covering tens of millions of Californians, told CBS 8, quote, "The lawyer behind this measure is trying to use a murder and act of terrorism to market his political agenda. It's a repugnant action by anyone, but especially someone sworn to uphold the Constitution and law." Eisner says that he does not support Mangione's alleged criminal actions.
I agree with what he was arguing, but I don't support his method. And I am known for challenging things, but you have to use the law to challenge things. This is what I'm doing is the right way to do it.
And now that this ballot measure proposal has been submitted to the state attorney general's office, the public has until April 25th to submit its comments on it.
So then after that comment period is over, what happens next?
Well, the state attorney general is going to then review it, and actually he or the office will decide the official title for this. So at the end of the day, this proposal may not be officially named the Luigi Mangione Act, but for the time being, as we were saying, it's getting a lot of attention.
And that might drive popularity to get more signatures, which is needed to move it forward. So how many signatures are needed to be gathered for this?
Well, there's some math to it, but at the end of the day, it's more than 500,000, more than 546,000 signatures would have to, and that's going to take time, that's going to take money. So we'll see if it actually happens. And if it does end up on the ballot, it would be in November of next year. So we have some time.
All right, 2026.
Yeah.
Thanks so much, Richard.
Thank you.